Good morning and welcome. You're watching Republic TV. I'm Nupur Talwar Suri. Now, from corporate leaders to celebrities to ordinary citizens, everybody is stepping up and helping the country fight the second wave of the pandemic. Now, we now have one such guest joining us, celebrity chef and entrepreneur Sanjeev Kapoor. He joins me live on the show. Over the course of a few months now, Sanjeev Kapoor has been providing free food to the healthcare workers across India. Mr. Kapoor, good morning. Thank you for speaking to us on Republic TV.
Thank you very much. Thank you, Kapoor, for having me. Thank you very much.
Mr. Kapoor, now it's been an incredibly tough time, and it's also in many ways unprecedented in the history of this country. Now, especially for the medical fraternity, it's been very, very challenging. And I believe you set up a food service for professionals working in various hospitals. Tell us more about it.
Right. So actually last year during lockdown, I thought of it, and right from the second day of lockdown, we could facilitate this in many hospitals in Mumbai, Delhi, Bangalore, and we partnered with Taj Group of Hotels, and we could execute it and do it very well. And when the need went down, we discontinued it. And about 10 days ago, I got a call from my friend, and he introduced me to World Central Kitchen from United States, and they were keen to do something in India. And again, we started thinking that what can we do, how can we do, and we mobilized hospitals, we mobilized kitchens, we mobilized people, and with the help of again friends in the industry, a lot of people want to contribute, a lot of people want to do their bit. So I would say that I'm the Sutradhar, but there are many good Samaritans and organizations like World Central Kitchen who have come forward to do this. And of course, we continue to do this with the Taj Group of Hotels, where we are making this in some of their hotels, their flight kitchens, and we're looking at doing it in many more cities. The response has been very good. We have started from Mumbai. We are doing this in Cooper Hospital, Sion Hospital, Civil Hospital in Ahmedabad, and Deen Dayal Upadhyaya Hospital in Delhi, and Guru Tegh Bahadur Hospital in Delhi. And we are looking at other hospitals across the country. And I would encourage viewers who are watching this to reach out if there is need in, especially I would say government-run hospitals, where I feel there is probably more need, and we'll try our best to reach out and provide this food. The intent and the idea is that in all that stress, if we can add a few more smiles to lives of the hospital staff, could be doctors, nurses, ward boys, cleaners, whoever, we would like to do that and try and motivate them, because what they do for people at large is, I think, it's beyond compare, and a big salute to them.
Absolutely. As you're pointing out, Mr. Kapoor, tell us more about the hospitals in the cities that you're working in, because, a large number of hospitals, big hospitals, do have canteen facilities, but they've been severely impacted, because of a paucity of staff, because a lot of staff is being deployed elsewhere. So give us more details of which cities are you looking at currently, which are the hospitals that you are helping out, and, do you plan to expand pan-India?
Yes, definitely the intent is to expand pan-India. We are looking at large hospitals pan-India, like I've been trying to get Gandhi Hospital in Hyderabad on board, but I haven't had that luck. We are looking at Bangalore should start in next few days. So we are definitely looking at hospitals that may need this help. See, but we have to understand that there may be some hospitals who have everything, who are probably, they are managing well, but the intent here is that anybody who needs it, so we put the need, who has higher need, we try and reach out to them. And after assessing that, we try and execute it. And for execution, we want to keep it really, really safe. And I think that's very important, because we are talking about hospital workers, doctors, staff. So it has to be made and in a way that it is completely hygienic, safe environment. And that's why Taj Group of Hotels, especially the flight kitchens, come into play. And that's the intent. So I understand that there may be few places where we are not able to reach. I'm sure that that's something that I would look at doing it as a next step, that how to deal with that. But as of now, I think there is enough and more hospitals which we can contribute and help with. And we are looking hospitals which are large, which are catering to large number of patients, especially COVID patients, and that's the intent. And we are looking at food which of course has to be tasty, because tasty food motivates and helps everybody. And at the but definitely it has to be healthy also. And at the same time, we have to also take care, because not always they can eat food in time. So something that stays okay for a slightly longer period of time also. So we are, and through our experience last year, we have learned a few things. We're putting that back into practice, learning more and trying our bit. And I would say that it's not just me. And I would like to thank World Central Kitchen, especially my friend Jose Andres, who's been doing great humanitarian work, and his team for coming forward and helping India, and of course Taj Group of Hotels, who's executing this perfectly.
Now, Mr. Kapoor, your efforts prove that there are so many creative ways, essentially, in which each of us, in which business houses, in which entrepreneurs like yourself, you mentioned the Taj Group of Hotels, the hospitality industry can help people. Now, how did you come about this idea? And is there any message or any ideas that you'd like to share with, people who want to do more?
Sure. So actually, this started the day when lockdown was announced last year. I woke up next morning and I realized that I was really made redundant. I was not doing anything. I couldn't do anything. And I saw, actually through a news channel, I saw a hospital story on a hospital, Kasturba Gandhi Hospital, living in Mumbai. I didn't know that this hospital existed. And I saw that what they were doing, and I thought to myself that we should do something. And what can we do? We know food. Times were difficult. The flights were stopped, so I knew flight kitchens were empty. That facility was there. I could mobilize some of our chefs. I spoke to Puneet Chhatwal, who's the MD of Taj Group of Hotels and my batchmate, dear friend. And I said, we should do something. He said, tell me what, how can we do it? And we just started small and we kept on making it bigger and bigger and bigger. And at the same time, I spoke to a few friends in the hospitality industry who had their kitchens which were idle. And I spoke to them. I said, you know what, you can call some staff who lives close by, make it safe, start cooking, and there would be enough and more people who would probably contribute. So it will keep your kitchen going. You can charge a reasonable price, give employment to people, and help people. So I have a few friends in Delhi, Gurgaon. They did that, and they fed lakhs of people from the facilities that they had. The whole industry, through National Restaurant and Industry, also did the same thing. And whether it was hospitals, whether it was migrating people who were moving from one state to the other, or anybody in need. And in Mumbai, I got together a few of the restaurants who I'm friendly with, and I put them in touch with many people who wanted to fund. See, there is always people who want to contribute with money, but they cannot execute it. And there are people who need that because they want to keep their kitchens going. And if more people can put this together, I think more people can be helped. And that's exactly what I did. And I'm glad that we could scale it up. And I am happy with learnings from World Central Kitchen, who do it at a much, I would say, at a global scale. There's a lot of learning that we're getting from them also. And I hope that we'll be able to scale this up even bigger.
Right, Mr. Kapoor, thank you very much for joining us. You know, you inspired each of us here at Republic Media Network and all our viewers who are watching, you know, with this story of creativity, of how innovation can actually help people and everybody about us deal with this pandemic. Thank you for talking to us. It's been a pleasure speaking with you.
Thank you very much. Thank you.